Hello and welcome. I'm Dr. Michael Knapp, naturopathic physician at Root Natural Health, bringing you the wisdom of nature balanced with the science of medicine. And I wanted to share a brief video with you about small intestinal bacterial overgrowth, or SIBO. This is a huge hidden cause of irritable bowel syndrome. One study showed that as many as 84% of cases of irritable bowel syndrome had a small intestinal bacterial overgrowth component. So I wanted to share with you a little bit of what is it, what are some of the risk factors, and when do I suspect it, because this is really key. A lot of physicians are missing this, have never heard of it, or are just glossing over it as something that doesn't need to be addressed. But in my experience, and in most people who have had and treated successfully SIBO, it's absolutely crucial for their health to get it under control. So small intestinal bacterial overgrowth is an overgrowth of bacteria in the small intestine. So it's not an infection per se, but the normal bacteria that are supposed to be in our large intestine have migrated to the small intestine, which is supposed to be at least 10 times less abundant with bacteria than the colon. There was a time where we used to think that the small intestine was sterile, but at this point in time we know there are supposed to be bacteria there, but just many, many fewer bacteria than the bacteria-rich large intestine. And that's a careful distinction. And because of the nature of the small intestine having a very low oxygen content, we identify these bacteria as predominantly based on the gas that they create. So not necessarily their species, but what is their byproduct or waste product. They eat your food and your sugars, and they create gas, and their gas becomes your gas. And that can be a definite unpleasant part of irritable bowel syndrome for many people. So some of the risk factors for having SIBO include having any part of your intestines removed. Along with that, any delayed or dysfunction in the movement of your intestines. So this sometimes is called gastroparesis, and that can happen with people with diabetes or nerve damage and things like that. But many people have a functional problem with their bowels moving correctly. And this is something that we need to correct in the long term to reduce people's risk after treatment as well for a reoccurrence of small intestinal bacterial overgrowth. So I'd mentioned that diabetes is one of the things that can predispose people, as well as being overweight. Any increased weight around the midsection is a definite risk factor for SIBO. And there's also decreased immune system function as another factor, and this can happen whether you're taking medications that push down your immune system, like maybe you're taking these for your Crohn's disease, or maybe you're taking these for rheumatoid arthritis, or for psoriasis and psoriatic arthritis. Those can be a huge cause of decreased immune activity, which puts you at more risk for overgrowth of bacteria and infection, which again, these are two different types of disorders, infection versus an overgrowth of bacteria that are supposed to be there but just too abundant and in the wrong location. Other things that can lead to decreased immune system may be stress. Because excessive or insufficient stress hormone can lead to permeability in the intestinal tract and also disrupt the immune system and their ability to fight off and regulate bacteria and microbes within the gut and other places in the body. So your lack of stress management may be a huge component to SIBO and irritable bowel syndrome, which we do see that with IBS, many people do have anxiety and depression with it. And this is not a moral deficiency, but we do see that people are more susceptible to those conditions, and it's very common that they come together. And that probably has to do with the bugs that are there feeding forward and negatively affecting your neurotransmitters and the way that your vagus nerve communicates with your brain. So there's things that we can definitely do to work with that. Finally, there's low thyroid function, and this is actually one of the biggest risk factors for SIBO. And I don't know if it's because the low thyroid function leads to decreased movement and insufficient movement of the gut, allowing for small intestinal bacterial overgrowth, or if the small intestinal bacterial overgrowth itself has something to do with feeding the hypothyroidism. But this is another risk factor that we need to identify, and we can treat and manage hypothyroidism adequately in order to maintain then remission of small intestinal bacterial overgrowth. So some of the clinical scenarios where I suspect SIBO are when gas and bloating are the predominant symptoms, and not just a little bit of gas and bloating, but this is the big thing, and this is the part that is really holding somebody back and taking up a lot of their mental and physical energy throughout the day. So when that is really in the forefront of the picture, I really think of SIBO. Next is when people are better from antibiotics. And this isn't something that we see all that often. When you're taking antibiotics, say for an upper respiratory infection or something like that, and your digestive symptoms improve, if I can elicit that in the history, I begin to be suspicious of SIBO, and screening for that may be really helpful. Counter to that is when people are worse from probiotics. And this is not something that we see all that often, where people are definitively worse from taking a probiotic. Many people, their stools may change and then normalize, and they get significant benefit after as little as 5 or 10 days. But for the person who's definitively worse from probiotics, this really comes on my radar as something I need to be thinking about. Number 4 is worse from a gluten-free diet. So hold the phone. Worse from a gluten-free diet. You're saying that there's somebody out there who needs gluten? No. People may be worse from a gluten-free diet because they're not eating gluten, and they've substituted many of their favorite foods with highly refined gluten-free grains, starches, gums, and things like that that will feed bacteria. So it doesn't have to do with the gluten-free diet. There's nobody that is really suffering by not eating gluten. But on the other hand, when you do move to the gluten-free diet, if you are not eating a predominantly whole foods diet and you've just substituted highly refined gluten-free baked goods and pre-prepared items for the formerly gluten-containing dietary items, this will lead to a lot more raw materials for bacteria to eat. So when the person with IBS comes in, they say, I tried a gluten-free diet and my symptoms got worse. This is something that I elicit through questioning then to figure out, is it the highly refined starches and things like that? And many times the answer is yes. And then finally, when somebody's worse specifically from garlic and onions, I think of SIBO. Garlic is a fairly common food sensitivity in and of itself, but I also want to think of it when in the context of SIBO as not a sensitivity, but because of the certain kinds of sugars in garlic and onions that are raw materials that feed bacteria. When somebody has this as part of their digestive history, I definitely want to investigate further. Okay, so these are some of my real clinical pearls for when I start to suspect SIBO as part of IBS. And then we can go through very simple and cost-effective methane hydrogen gas production test to test for SIBO and look at that as a potential part of someone's irritable bowel syndrome that is readily treatable. Again, up to 84% of people with IBS do have an SIBO component to it. So thank you for sticking around. Please like the video, share it, and I look forward to sharing more information with you in the future. Okay? Again, it's Dr. Michael Knapp with Root Natural Health, bringing you the wisdom of nature balanced with the science of medicine. Till next time.